Hey, welcome back to the 2023 SIEDC Business Conference. We're joined now with Dr. Brahim Ardolic from Staten Island University Hospital and Northwell Health. Thank you for joining us.
It's a pleasure to be here.
What a great day to have him.
We had a big day the other day. We broke a record.
Truly amazing.
So
to make a puzzle piece of that size, that many people together in the same place moving towards one goal, it's always a special thing.
Well, the stadium, you guys have the naming rights to the stadium, correct?
Yes.
And it's the
Staten Island University Hospital Community Park, and I think that was important to us because for us it wasn't about even necessarily about minor league baseball. It was about the fact that you had a fallow stadium, something that was a symbol of something that had left Staten Island, and to be able to restart something and be involved in something that can really serve the community and get so many kids that have never been to a baseball game, right? And to really kind of help develop something that hopefully will continue to develop the North Shore of Staten Island in an area that you really want to get more people spending money. Our measure of success would be that we start seeing more restaurants pop up, more things to do in that area. That's really why we wanted to be involved.
So I think something that's unique, though, is that you're in that ballpark and in the space that you have. It was a unique opportunity to be able to do something different than just baseball, which is a big part of what you guys are starting to engage in the community as well.
Yeah, and the fact that it had something to do with autism, and spectrum disease is something that affects so many Staten Islanders, and it's something that so many people suffer from quietly, and so many families. We've gotten to a point where, does anyone know a family that isn't in some way peripherally affected by autism, whether it's their child, their nephew, their next door neighbor? It's become something that is almost ubiquitous. Like we all know someone. So that's on some degree of the spectrum, and it's such an incredibly important thing. So anything we can do for awareness is a really big deal for us.
One of the most unique things about your brand, I have the privilege of knowing some of your teammates and key players, John Delaez and Christina Zal, and one of the things I find interesting is how you are so involved with and want to be involved with the community in every way, from the stadium to working with guys like me on events that are hosted at Mount Loretto Catholic Charities of Staten Island, working with guys like me for the South Shore of Staten Island in the South Shore Business Improvement District. It's something that when you think hospital, when you think healthcare, you're not thinking about all the work you guys are doing behind the scenes. So can you talk a bit about why it's so important that you be such a key person within the community?
It's a cornerstone.
Well, Staten Island's a special place, right? So you think about what we are, it's about 500,000 people. It's the same size as Kansas City or Atlanta, for God's sake, right? And yet, there is this underappreciation of the fact that as a community, we can really raise all the boats together, right? You think about how much money is raised in philanthropy on Staten Island, how much money is actually spent on Staten Island. I'll give you a perfect example. When was the last time you actually thought about when you go to a big business on Staten Island that's all over the country and they ask you to give money? Did you ever ask yourself, I'm just giving $5. How much of that money is going to be spent in my community? And the answer typically is none of it, right? So what we're trying to do is to build the awareness and to have it go both ways of saying, listen, we're all in this together, and we want to spend our dollar on Staten Island, and we're really hoping that people will also recognize that that's where your money should be donated. That's where you should be spending money on. It's not just about your own kid or about your own parent, but it is about your neighbors, and it is about your friends, and it is about supporting each other as much as you possibly can. So we do feel that, we have a role that we can actually play. And, we can't be all things to all people, but as we're able to help in certain ways and as we're able to help raise everybody's boats, we really believe that it's going to create an environment where people realize the benefits of working with us and helping us as well.
Now, being a part of Northwell Health and having in Staten Island all throughout Long Island, do you market and brand differently here in Staten Island in this community versus you do in Long Island?
So, unlike a lot of companies, Northwell really does try very hard to keep your care local, right? So that is atypical in the modern healthcare environment, especially in New York City. But we're the only company that really has, multiple tertiary care medical centers, and we're really trying to keep people in their own community because the data suggests that you feel a little better. You definitely make it more convenient for family. So yeah, we do market a little bit locally, but within the greater context of the brand, a lot of our marketing is still based upon the greater Northwell brand. But at the end of the day, locally and getting people to understand that there are slight variations to what we're able to do here versus in other places. Yes. So the answer is, like most things, yes and no. There's a lot of things we do with the general Northwell brand, and there's certain things that we're very specifically Staten Island.
I think one of the unique things you do is tell a story. right? And you do so in your video content, which is played across social media and your website. Talk a little bit about the story of the brand and how you have all these different marketing things, such as video content, such as being involved in the community that are promoting the brand.
I think it's like everything else with a brand, right? There's brand recognition, and then there's connecting the brand to what you're actually trying to establish, right? And they're actually distinctly different things. The Northwell brand, if you think about it, the fact that we've only been known as Northwell now for about 5 years, and then most people don't realize that. And the fact that there's been such an incredible amount of effort done in establishing this as like an over-encompassing brand, and the team has done an incredible job of doing that. What we've really tried to do in Staten Island is really demonstrate that we are Northwell, right? And that what we're talking about globally is what you're able to get here. So a lot of what you've seen locally is us attaching itself to the brand. I think 4 years ago, I'm not 100% sure that people would have associated SIUH with Northwell as specifically as they do today, and that's been very purposeful.
Done a great job.
So what else, Doc? What do we have coming up? Is there anything new that's on the horizon for Staten Island University?
It's going to be another year of firsts. You know, we continue to do a lot of great procedural care that we weren't able to do before. We just recently, 2 weeks ago, did the very first procedure to actually cure people of sleep apnea. There's now, if you have certain kinds of sleep apnea, you don't actually need to wear a mask anymore. If you meet the criteria, you can actually get something put in, which will fix it.
I think 2 out of the 3 guys sitting here need that.
I definitely do.
And it's not me.
I definitely do.
If you meet the criteria, it's not for everybody. There's now a device that you can actually implant that will actually get rid of your sleep apnea and actually improve your long-term health outcomes. We did the very first one on Staten Island just a few weeks ago. We're really excited to do that. We just recently hired an ENT doctor this time last year that is one of the first in the area that's able to do it. So we're really excited. Dr. Blasco did his first couple, actually, all on the same day. But those are the little things. We continue to do a lot of those types of procedures in so many different areas. That just happens to be the one that was on the tip of my front of my brain because it just happened.
Well, you're saving marriages with that procedure, so that's real
100%.
Lots of things.
And people joke around about sleep apnea, but the reality is it shortens your life, right? If you don't get your sleep apnea treated, your life is shorter. It just is. There's really good data on that. So if you have it, you got to get it treated one way or the other.
Well, it's literally cutting oxygen off from your brain, correct?
100%.
Right.
And it forces these weird cycles of how you sleep and then you don't sleep. And there's all this data that actually suggests that just the lack of sleep is what actually shortens people's lives. So whatever you can do to actually increase their sleep, there's a key association to how well you sleep, not necessarily how long, how well you sleep and how long you live. So that's really one of the things that's associated with that. And then the 2 biggest things that we're going to be doing over the next several months is our brand new $50 million cancer center will be opening in the fall.
Wow.
And our $200 million new mother-baby building, the Grapuso Women and Newborn Center, will be opening come late fall, early winter. And for us, it's revolutionary. So for everyone, it's a private room, beautiful brand new room with no extra charge. So you deliver in a private room with your significant other but by your side, and you don't have to pay any extra money for that. So we're really excited about being able to bring that to Staten Island, and we think it's going to be a game changer for the women of Staten Island.
If people want to look up any information about it online, what's the best way?
If you go onto our website, you just look up Staten Island University Hospital. If you look up Newborn Center, we'll lead you there. The other thing you can actually do is we have video content that's actually being done right now. So if you look up our content on YouTube, you'll be able to see everything that we're actually doing, and there'll be some new video coming up about the Women and Newborn Center really soon.
That's great. That's exciting. And thank you,
stuff.
Dr. Ardolic, for joining us. Thank you for everything you do in the community and supporting the efforts with the World Record, with the Grace Foundation, and everything else.
Thanks for having me.
Thank you. That's a wrap.